Sean Edward Kovacic, Kovacic.
And what is your occupation, sir?
Police officer.
And where are you a police officer?
Willowick.
How long have you been a police officer in Willowick?
In my 10th year. Yeah, I went through a lot of training through the city of Cleveland. I worked there for a little over almost 3 years. But I've been in Willowick for 9 years now, in my 10th.
And what is your assignment there in Willowick?
Patrol.
And what does that mean?
Answering calls, traffic stops, crime prevention.
You're in uniform today. When you're working, are you wearing uniform?
Yes.
And you're in a marked cruiser?
Yes, ma'am.
Were you working in that same capacity back on May 24th, 2024? And did you get a call that day regarding this case and regarding injuries to McKenna?
Yes.
How were you alerted to that?
Mentor called, I guess the call originally came to Mentor, and they had called our dispatch. And,
Hold on just a second. I'm sorry, I did say May 20th.
that Mentor had contacted us that incident had happened in our city. They originally thought it happened in theirs.
Okay, Mentor had contacted us. What did you understand that to mean?
So Mentor Police was originally contacted. They initially responded when they found out that it happened in our city, that they contacted our dispatch to have one of our guys go down and take the call.
Go down. Where did you go?
Rainbow's Babies Children's Hospital.
And were you in uniform that day?
Yes, ma'am.
And when you remember around what time it was that you went there?
I'm not sure. It was day shift.
When you got down to Rainbow Babies Children's Hospital, what did you do?
I was met by the 2 detectives, and they gave me a briefing of, they did the initial interview.
2 detectives. Who are you talking about?
2 Mentor detectives.
Those were the initial responders.
Yes, they were down there.
And from talking with them, what did you understand to have already been accomplished?
If there was a child, possible child abuse, maybe there was an ICU from our city that had a brain bleed that was transferred from Lake West Hospital over Willowick down there.
Did you talk to any of the medical staff there at the hospital?
Not initially. I was met by them and talked with them, and then later on I had.
And then were you aware of the parties that had brought the child to the hospital who were accompanying the child?
I was given the names, yes.
Okay, what were those names?
Megan Bako and Cameron Dreyer.
And you understood those to be related to this child how?
Well, originally I thought they were both the parents, but I later found out that Cameron's just the living boyfriend in the house.
What about Megan Bako? What did you understand her to be?
Megan is the mother.
When you got to the hospital, were Megan Bako and Cameron Dreyer together, physically together?
Yeah, they were in the room with the child.
Did you talk to either one of them?
When I first came in, I talked with the detectives. I went to the room. Then I told them I was there, and I separated them both to have them fill out statements for the incident.
Who did you talk to first? If you know, if you remember.
I can't remember who I talked to first. I know I had escorted Cameron down the hallway to the family waiting room to fill out a statement, and then also gave Megan one. She was in the room with me.
Whether or not the mentor detectives had already spoken to you.
Yeah, they had. Yeah, they had an initial interview with them.
particular?
It is.
What is it?
It's a written statement from that day.
From that day, on the 28th of May, 2024,
Yes, ma'am.
that you collected at the hospital, is that correct?
Yes.
Is it in substantially the same condition as it was when you collected it?
Yes.
Do you see the person that you know as Megan Bako, the mother of McKenna Rae? The person who filled out that statement, do you see her in court today?
Yes, ma'am.
Would you point her out, please? And describe what she's wearing.
Tan sweater. Yes.
The record can reflect that he's identified the defendant.
Yes.
In your, that she was then living at that time in the city of Willowick, Lake County, Ohio.
Yes.
And did you ascertain who she was living with?
Yes.
Who?
Mr. Dryer.
And what about the baby? Did you understand where the baby had been living at?
The baby was living with them.
In Willowick, Lake County, Ohio?
Yes, ma'am.
Mentor officers, was there anybody else there at the hospital regarding the injuries to the child other than the medical professional?
The job of family service.
And what is that? Tell me who is there, if you know.
What his name was?
Do you know the name?
I don't know his name, no.
Okay, but you knew that there was somebody from that agency.
Yeah. I believe I got his card, and it's in my report. I think it's, I think it may have been Nick or something, Nick or Zach. I can't remember who it was.
Zach?
Yeah.
Right?
It was one of the two. I got his card, and it's in the report, but.
What is your understanding of that person's role?
They do an invest on, his bank. Just brief talking, that's it, and then I got his card. I mentioned to him that the other detectives would be getting a hold of him and talking with him more.
Did you see the baby?
Yes.
Where was it that you saw it?
It was room 17 in the ICU of the district.
Who was with little baby McKenna at that time?
When I first got there, when I walked in, I believe a nurse was there, and then Cameron and Megan were both there, so on the couch.
And then you said that you separated Cameron and Megan, correct?
Yes.
What did you do when you saw the baby?
Just did an initial view of the baby, and then I was talking with parents, and just, like I said, getting the initial report out for the incident that happened.
When you go respond to a call such as this, are you outfitted with any special equipment?
I brought a camera to take pictures of the baby's injuries when I was told before I got there.
Did you have a camera with you?
Yes.
And did you take pictures of the baby?
Yes.
Did you have any other equipment on your uniform?
Just my body cam.
Tell us about the body cam. What's that?
It was body cams, basic use, for all calls we put it on.
I'm going to hand you what's been marked as State's Exhibit 2.
Objection?
I received just a flash.
I'm sorry, yeah, it's a flash right off that.
I'm not up yet.
You're good. It's admitted you made a motion.
There's video, is there sound as well?
Yes.
Well, you turn the lights on or?
Yeah, but it doesn't bother baby too much. I'll try to keep the flash off so it doesn't do too much. Yeah. Is it just the head it, or is there anybody?
It's mostly the bruising, so I know about it.
You're not gonna be happy. Is there more on that side? Is there on the back or anything?
I didn't see anything initially on
No,
it.
okay. Nothing on the top of the head. I want to see if there's any push this way. Over there. Oh, the pupils.
There we are.
Yeah, they're good.
I guess they were unequal downstairs, but they've been even, yeah.
And then, since she's came up here, anything changed at all?
No,
Response to anything?
we were questioning whether she got a seizure.
Okay.
So after they get the MRI of her head, they're gonna put the leads on her head to see if she's having any seizures.
Okay, okay, very good. Well, people's been fine since she's been up here. Okay. No bleeding from the ears or nose, nothing like that? No, okay. All right. Anything else besides in the last couple months with the baby roll off the bed? Anything at all extensive in that?
No, that was about 6 months ago.
Okay.
Like I said, we take baths with her sometimes. He's got a shower head and it's like a detachable one.
Okay.
Sometimes if it's not put on correctly, it falls,
Okay.
but that has never hit her.
Okay.
Shampoo bottles, if they're on the ledge
Yeah.
of where it's at.
Swing and hit the,
Yes, and that did happen a few days ago. She had.
couple days ago, one of the shampoo bottles in it?
Yeah.
Okay, like how high would the bottles be? Are they like in a hanger above the thing or?
Say she's right here in her little bath, but it's like eye level for me.
Okay, so probably about 4.5 feet off the ground. Okay, and that was a couple days ago?
Yes.
Okay.
Yeah, that happened, and that's really it. It's nothing like,
Just one bottle hitter?
yeah,
Okay.
I wasn't in the bathroom with that, with
Gotcha.
her, he was with her, so, and he told me because it's happened before.
Was there any bruising after that, or did you act any different, or anything like that after?
No acting different.
Okay.
I'm sure a bruise probably popped up.
Okay.
I've talked to her doctor about her bruising because it's been an issue.
She's very active in her crib? Or?
Yeah, she's very active in the crib, just very active trying to sit up. Like, her doctor said it was normal, and if it became an issue, that she was going to order blood work.
Okay.
It's all documented.
Okay.
She, yeah, that's the only things I can really think of.
Okay. I'm gonna let you guys finish these up. Cameron's finishing up, like I said, just be as detailed as possible for the last 2 days or so. And like I said, one of the detectives will be at hold of you guys, talk with you a little more, and go through some things. Have you come in once she's cleared and she comes down, goes back home and stuff like that. Is everybody else at the house?
Yeah.
Okay, so we might go over there and talk to everybody at the house too, just to And then mom, does mom have the baby over?
My mom,
No, okay. So mom, she's never alone with the baby or nothing like that? No, okay.
I'll bring her to my mom's,
But that's it?
yeah.
Anything ever happen at your mom's, something like that? No, okay. All right. And your mom's Amy, right?
Yeah.
Okay.
We're usually only there for an hour or two.
Just visiting?
Yeah, just
Okay.
visiting, just saying hi,
Okay.
eating dinner,
Okay.
leaving, that's what it is.
All right.
I think we were just there Sunday. I was just there Sunday with her.
All right. Okay. Like I said, just finish that up and then we'll go from there, okay? And I'll, like I said, they'll be holding it the next day or so. All right.
objection?
No objection.
They're admitted and you may publish.
Of pediatric radiology.
And you mentioned that you are the director of the residency program.
Yes.
What does that mean?
That means in addition to taking care of patients, which is most of my time, there's a portion of my time that goes to an administrative role in the residency program where I'm making sure that all of our trainees are learning appropriately in all of their rotations. They're getting through the residency appropriately. Essentially, we look at how they're doing and making sure that they're fit to graduate once they're
And you stated you're an assistant professor as well?
correct.
What do you teach?
Well, it's in pediatric radiology because it's with Case Medical School, Case Western Medical School, and we have students who rotate with us too. I'm board certified by the American Board of Radiology. That means I pass their examinations, the board examinations. And I am subspecialty board certified in pediatric radiology.
Are you a member of any professional organizations related to your field?
Yes. Association of Academic Radiologists, the Society of Pediatric Radiology.
So, the university hospitals, are you, and you mentioned a little bit the different types of scans. What types of scans are there?
So anything you can think of that's imaging related in medicine, for the most part, is what we do in radiology. So again, X-rays, CAT scans or CT scans, MRI scans, ultrasounds. Those are the main ones that we do.
Can you tell us generally what the difference is between the different types of scans? We'll get into further detail, but generally, could you explain, if possible, the different types, those four types: X-ray, CT, MRI, and ultrasound?
Detail there, but X-rays and CT scans are obtained using radiation, and an X-ray is like a two-dimensional image, like a picture that you would look at. A CT scan or a CAT scan, some of you may have seen on a medical show or something, it looks like a donut tube that somebody would go through. It takes slices through the entire body, and it's sort of like taking an X-ray, but many X-rays through the whole body in slices. And an ultrasound is, you might think of it, on a medical show or something, when somebody goes to, when they're pregnant, something like that, they put the probe onto the belly, and you can look anywhere, obviously, with an ultrasound probe. So you take a probe, and there's gel, and the probe allows you to see into the body, and the technologist will move it based on where you think there might be an issue. And then we can look at those images. And then an MRI is a bit different. It uses, I don't want to get too complicated, but spinning of water molecules. And there's a machine that can it spins your water molecules, and then from that spinning, it takes a picture. You can believe it. It's really neat how it works. And but it takes pictures in slices, sort of like a CT scan or a CAT scan, but without the radiation.
Are you familiar with MAKENNA RAE as a patient that was admitted to university hospitals on May 28th of 2024?
Yes,
Are you aware of whether she was administered any of those scans that you just described?
yes.
is she receiving this, the X-rays, CT, and MRI scans?
When she came in, well, she came in to a doctor who was worried at the time, based on their physical exam findings, that there would be injuries. And because I'm not that physician, they tell me in a sentence or two when they order a scan that they're concerned based on the patient's symptoms that they had or the physical exam findings that they came in. And I don't have the exact sentences that they wrote in there right now. I can't remember the exact sentences, but I believe it was something to the effect of, worried about injuries, potentially having pain, things like that.
Is that, those few sentences are just for your background as these scans are being read, is that fair to say?
Correct.
And did you evaluate the scans that she received from her physician on May 28, 2024?
I read some of her scans.
Moving on to the next slide. This says CT head 5/28/24 at the top there as well. Is that right?
Yes,
Does that mean that the CT was taken on that date?
yes, it's the same CT.
And what can we see here?
Here, I was just showing the bones. This is a 3D reconstruction of the bones of the head. These jagged lines are sutures. They're actually normal. It's how the head grows when a child is born and their head has to keep growing, right? So I'm just showing here that we can look at the bones on 3D reconstructions like this. We didn't see any fracture on this examination. So the bones themselves looked normal. X-ray 5/28/24.
And what can we see here?
So I'm showing on the skeletal survey there are two abnormalities, and if you progress, there are arrows on there too. But
I'll move to the next slide.
oh, sure. Maybe one more. Okay, so this skeletal survey shows two abnormalities. First, where the arrow is clavicle fracture, and the second is a posterior rib fracture here. And my next images zoom in a little bit so you can see them a little bit better.
I'll move to the next slide.
So there's a left clavicle fracture. Remember that the patient radiology right and left are the opposite of what we normally do. So this is the left side of the patient here. And you can see that this clavicle is larger than this clavicle here. And that's because there's a fracture there that's been essentially remodeling itself.
What do you mean by that?
I mean that it's an injury occurred to the clavicle, and when bones fracture themselves, they have to repair themselves. And while they're repairing themselves, they make new bone. And during the repair process, they will look a bit, sometimes a little bit bigger, because the bone itself is now bigger because it's been trying to repair itself, if that makes sense. And the right clavicle here. Let's look at X-ray. A bone that, well, let's see. You cannot start to see this remodeling process in the first few is not days old. And probably by the amount, how big it is and how much remodeling has gone on here, it's probably more than a week old. It's probably more than a couple weeks old. It may be a few weeks old. It may be, could be a month or two old, something like that. It's hard to tell exactly, but I know that it's not days old, or even probably, that makes sense. based on the amount of remodeling I see, I wouldn't be able to see that if it was just days. You know, the bone can't make that response just a few days or even a week, this much response. That makes sense.
And you stated it could be a month or two old.
Yes,
And is that based on the remodeling process that you're able to see in the scans?
yes.
Is this another slide pointing out that fracture?
Same thing, yeah, just pointing to the
Moving on to the next slide. What type of scans are in this slide?
So this is that same, it's a chest x-ray from the skeletal survey. It's the same image, but here I'm a bit zoomed in on posterior rib fracture of the left fourth posterior rib, where that's what I'm trying to show by this square. I zoomed in, and the arrow is pointing to the fracture. And similarly, this rib has remodeled itself to an extent very similar to the collarbone fracture, the clavicle fracture. I can tell that it's not acute, meaning it's not, you know, again, just in days. Probably the same time, you know, similar time course like that. The clavicle, where there's been some time where the bone has been remodeling itself. And maybe a little tough to see, but I'll try to point it out the best I can. So if you look at the normal ribs, they kind of have this nice smooth contour to them, the upper part of the ribs down here. And this rib, it's not subtle, but there's this little hill here, and that's where the bone has remodeled itself, and at the bottom too. So the bottom of the ribs, there are like little arches here. And this one has a little convex border to it that's abnormal. It shows that the bone has been modeling itself.
And this is the left side of McKenna, is that right?
Correct.
And are you able to tell if it is the front or the back of the body?
Yes, it is a posterior or back. It's the back of her body. It's the, we call it a posterior portion of the rib.
Posterior means back.
Means back, yes. Tibia and fibula. And that is your bone in your lower leg that goes from your knee to your ankle. And so this is the top, like where my pointer is would be where her knee would be. And down here is the foot, to kind of orient you so you can see. So this is, you have two bones in your leg in that location, the tibia and the fibula. Tibia is the bigger one, and the fibula is the skinny one. So I zoomed in a little bit on this too. This one's to help orient you with the knee, foot, and then I'm zooming in here. And I'm showing here that there's abnormal density, and we call it sort of heterogeneous density to the bone, which is not normal, within the tibia here. And that's, what I mean by that is there's areas of brightness that shouldn't be there and interspersed with dark areas. Instead of being kind of smooth and homogeneous, it's very heterogeneous. And on top of that, there are some linear lines, and this is showing that there's a fracture of the tibia that is also remodeling itself. This bone is essentially doing what it can to heal this fracture. Just with the clavicle, just like I said with the clavicle or the rib fracture, I can tell based on the density and the remodeling here that this is not an acute fracture. It's been remodeling itself for a while here, probably at least weeks, maybe months, remodeling here. there's an area at the inferior or bottom part of the bones here with the circles, where the radiologist who read the scan noted that it was suggestive of a possible fracture down here also. Now,
That would be the end of the lintel,
the ends of the bones,
where the feet are.
correct, like where the feet are. And from my perspective, I see what he's saying, and I agree that it is suggestive that there was a fracture there. It's just more subtle than these other findings. That makes sense. That there's clearly fracture through the upper to mid portion of this bone. And I think, the bottom part, it's possible that there's a fracture there too, is what I would say.
The next scan, are we looking at the other foot here?
So we're looking at the other
Or
leg.
Other leg, I'm
Yes.
sorry.
So that was, just looked at the right, now we're looking at the left leg, left tibial and fibula. And this bone is also remodeling itself as well. There's a clear fracture line through the bone. So this, you can see where my pointer is, where the arrow is, that almost like a diagonal line.
And
That's
it died from upper left to lower right corner, is that what you're pointing?
Yes, yes. That's a fracture line through the bone. And then this wispy material here along the edges of the bone, that's the periosteal reaction that we see where the bone is remodeling itself. And then
Due to a fracture, is that right?
due to a fracture, yes.
And is there anything about that periosteal reaction, or that you can otherwise see on the scan that could give you maybe as to timing of this?
Yes, so with the periosteal reaction and the brightness of the bone, again, it suggests that this bone has been remodeling itself for a bit of time. So again, it's not just a few days old. It's, at least a week old, could be a few weeks old, could be a month or two old. It's hard to date exactly, but I can tell that it's not just a few days or even just 1 week. It's more than that.
This next scan here, or next slide, what is this, what type of scan is this image of?
Well, this is now an MRI of the brain.
Was this MRI also taken of mechanic RAE on May 28th?
Yes.
What can we see here?
So here, and if you press, I think I put arrows, a circle on there too. So the arrows are showing, now this scan is a little bit lower from where that CT head scan slice was, just a little bit lower. And MRIs have,
When you say lower, do you mean lower in the images of the brain?
yes,
We talked about this, like
So-
images.
just one slice, but it's of all the slices we got of her brain, the CT head was closer to the top of her head. This one is still near, that is blood. And remember, this is the left side, and we can see a little bit of blood wrapping around the brain here. And on the MRI, there's actually a little bit of blood wrapping on the right side too. And then,
Why was this significant to you?
well, I'm showing this because an MRI can sometimes be a little bit more sensitive than a CT scan or a CAT scan. It might show you things on it that you didn't see on an original CT or a CAT scan. So I'm showing here that we didn't necessarily see that there was a little bit of bright blood on that CT scan or the CAT scan, but the MRI is showing that there's actually a little bit on the right as well as the left. We knew there was some on the left already from that CT scan. But this MRI is showing that there's a little bit also on the right side too. And in addition to that, the circle is showing that there's this dark material here is also blood. So, and just to show you, so these areas here where it's brighter, these are the rest of the ventricles here. So the bright material is normal fluid that we have in our ventricles. This dark material is some blood.
What type of scan do we have on this next slide?
So this is also an MRI of the brain. And this is called the diffusion sequence of the MRI.
Is that a type of MRI, diffusion sequence?
It's a part of the MRI that we do. We do different sequences, and this is one of the sequences that we do.
And this one appears to have been taken the next day, May 29th.
Correct.
And what can be seen on this MRI from the next day?
So on this sequence, and I'm showing two slices here. So the first one is a little bit high up, like the last, like the CT head scan, or even maybe the last MRI scan that we showed. This one is a little bit lower down. That makes sense, but we have two slices here. So the bright, I'm trying to show that, so we're seeing the brain here. The whole thing is the brain. And the normal intensity, signal intensity, is sort of this gray. That's what the brain should look like. But we're seeing areas here that are too bright. So that's what I'm trying to show in here, that there are areas here, like where my pointer is. This is on the right side, on the left side, the back of the brain. And those are too bright. And here on this slice, which is a little bit lower, these areas are too bright also. This is at the front of the brain and at the back left of the brain here, where my pointer is now. This would be more normal, this, or like this area. That's what the brain should look like. So this is all abnormal bright signal intensity.
Does that abnormality indicate blood?
No.
What does it indicate?
So in this case, this is indicating that the brain cells are swollen. And we call that, well, the medical term for that is cytotoxic edema, but
Cytotoxic edema is brain swelling.
yes.
Why would the brain swell?
Objection.
The same.
Was this an abnormality that you noted?
Yes.
In this next slide, this is another scan of, or MRI scan for May 29th, the next day.
Yes.
And what did you make note of here?
Actually, it's the same thing as the last one. It's,
Is this still the brain, imaging of the brain?
yeah, so now this is very low in the brain, and this is an area of the brain called the cerebellum. It's almost just above your neck. Think about it like that. It's at the back of your brain. It's still the brain. And I'm showing here that there's some abnormal signal intensity in the left cerebellum here on the diffusion. This is a different sequence. It's called T2, but either way, they both show that there's swelling here as well, on the left cerebellum.
What scan do we have here in this next slide?
So now, this is an MRI of the cervical spine.
Is this also from the MRI May 29th?
Yes. And I showed 3 images here. And the cervical spine is the spine of your neck. And I have a midline image that's right in the middle. And then I have one off a little bit to the left. That there's some fluid that shouldn't be there, essentially in an abnormal location. So fluid on this MRI is bright. and C2 vertebral bodies is this little sliver of brightness, this fluid that shouldn't be there on the left and on the right, here and here, a bit of bright fluid.
What kind of images are on this next slide here?
So now we're looking at a CT or CAT scan of the abdomen and pelvis by 29-24. And these are 2 slices. So again, in our whole scan, we would have multiple slices all through the abdomen and pelvis, but I am just showing 2 here. One is, this is called an axial slice. I was going to sort of slice through someone, if that makes sense. This is that, and then this is called a coronal slice, where it's almost like they were standing and facing you. You get one slice like this. And
So this one on the left is almost like bird's eye view over someone?
yeah,
So you could look inside and my body on the top.
yes.
And what is the point of view of the one on the right?
This one is if they're kind of standing and looking at you, facing you.
Facing. What have you noted here for the scan on the left?
So I'm pointing out, really on both scans here where the arrow is, because this is the same spot in both scans, that this gray material here is fluid that is abnormal. You wouldn't normally see that.
And this is in the abdomen, pelvis. What other organs or body parts are visible there on the right-hand side or left-hand? That could,
Yeah, so so this here is the liver, where I'm putting my arrow. This is the right side of the patient. And then under the liver is the kidney. And then, so this fluid that we're seeing is right underneath the liver, and it's next to the kidney. And,
should that fluid be there?
no. If you see this dark material here, that's intra-abdominal fat, and that is what we should see in this location, but we see this lighter gray material, so that's fluid.
Are you able to tell what type of fluid it is? What can we see here on this next scan for the CT head problem?
So I'm showing here that the CT head that she originally had on May 28th, this is a slice that's lower down from the one that we originally looked at where there was some blood. This is what she looked like on May 28th, and then this is a follow-up from a portion of her admission, 6/12/2024, at the same spot in the brain. And I want to I'm showing here that there's a difference here in how the brain looks over time now, where the best way to describe it is there's more space around the brain and in the ventricular system. And what I mean by that is, you can see on this follow-up scan, I talked about the ventricles in the brain. Those are spaces that have fluid, and that's dark on a CT scan, and you really can make them out very well here on